Well, I think just, physically being there, because you're going to have a lot of appointments and, sometimes a lot of travel. Like when I travel to UCLA, it takes me an hour and a half to 2 hours each way, to get there. So, just having a good support system, whether it be family, church members, community, friends, that can help you. Just being there, and I also think too, for me, it's important to have someone that I can talk to, so that I can talk about, what may come that's not so great. Like, I'd like to be able to talk to someone about my feelings about, planning my memorial service, or, I know, well, as an example, this is a perfect example. So my husband, I think he's coming around, but, in his mind, when I talk, when I would bring up, well, maybe we should, find a cemetery in the area, where we would like to be buried, when we pass away. To him, it was kind of like I was giving up in a way, because I wanted to go look at a cemetery. But from my perspective, it's like, no, I'm not giving up at all. I just want to be prepared. So I like to say, I like to plan for the worst, but pray and hope for the best, and stay positive. I feel like I'm a pretty positive person. But I just would like to have all those things in place, so that my family doesn't have to worry about it, if I pass away. So and he's coming around where he'll talk to me more about those things, where before, it was like, no, I don't want to, I don't want to talk about that. Are you giving up because you want to talk about a cemetery now? It's like, no, I'm not giving up. I just want to be prepared, and I don't want to have, for you to have to worry about it, If I pass away, I don't want you to have to worry about it. So, I think just whatever we as a patient need to talk about, even though it may be hard, like I know it's really hard for my husband to talk about those things, but he's coming around. So I think whatever we need to talk about, let us talk about it. And, well, I know the first time, I lost my hair from my first round of chemotherapy, I don't know what it is, especially for women, it can be really difficult to lose your hair, and then to have your head shaved. So, my daughter was a great support in that, because she shaved my head for me, and, but, I think we worry about those things maybe more as women. But the more I was around those that loved me, and can feel that, it didn't matter, one bit to them that I didn't have hair, and I wore the little chemo beanies, that didn't matter at all, then I was less worrisome about it. So, some of the things that, meant the most to me was, having someone to talk to, no matter what I wanted to talk about. The little, flowers left on the doorstep, just knowing that people care. Because sometimes, especially when you're going through chemotherapy, it can last 6 months, and then it takes a few more months after to recover, from that, and you're just not feeling yourself. Just letting us know that we're not forgotten, that you're still praying for us, you're still thinking of us. It means a lot.